My research really examines the effects of physical activity on cognitive performance in children. Our work here is centered around what we call the Kinetic Kidz program.
So with the Kinetic Kidz protocol, basically the children come in for 2 days of pre-testing. We'll take blood measures such as blood pressure, a look at markers like cholesterol. They'll get a fitness test. Then the second day they'll do some cognitive testing.
After they go through a series of cognitive tests, we put them on the treadmill. So we do a warm-up and then have them running or walking at about 80 to 90% of their target heart rate. The results that we're finding is that an acute bout of physical activity does positively impact cognition in terms of accurate responses and times to respond to a question.
We can look at cognitive performance from an imaging standpoint. These are EEG data. After children sat quietly for 20 minutes, there's not a tremendous amount of neural activation, so they're not allocating a lot of memory towards a given task. After 20 minutes of walking, there is greater neural activation. This is important in children, especially when they're learning new content. I think our most significant findings to date were actually a surprise to us. We thought that we were bringing in healthy children to participate, maybe inactive but reasonably healthy. And what we actually discovered is many of these children already exhibited risk factors that were similar to older adults.
And the surprising thing that we're seeing is that a lot of these children who we thought would be healthy are showing markers for pre-metabolic disease, which would be a cluster of risk factors such as high weight, high blood glucose or blood sugar, and then also low fitness.
Today we're actually seeing signs and symptoms in 5, 6, and 7-year-olds that they are at risk for some of these adult diseases in the early stages of their lives.
I was a public education teacher for the last decade. For me, as a teacher, the practical implications is let's get physical activity back in the classroom.
I have been working on Michelle Obama's Let's Move Active Schools campaign, and primarily my role is to educate parents as well as teachers on the types of things that they can do to provide opportunities for children to be physically active.
Kinetic Kidz is exactly on that mission. How can we incorporate physical activity into the classroom, and why is that something that we need to do?